Idiopathic pulmonary fibrosis, or IPF, is a progressive and fatal form of chronic interstitial lung disease, yet the exact mechanisms by which IPF occurs remain unknown. Multiple hypotheses have been proposed concerning the pathogenesis of IPF, including an early concept that chronic inflammation is an essential feature of pulmonary fibrosis, and an alternate idea that IPF develops secondary to alveolar injury and abnormal wound repair, independent of preceding inflammation. An emerging theory regarding the evolution of IPF unifies the previous hypotheses and suggests that IPF occurs as a result of an imbalance in the body's immune response to repeated abnormal stimuli or injuries to the lung. According to this hypothesis, repeated injury or multiple hits lead to an imbalance in the immune response that favors type 2-3 immunity over type 1, thus leading to an overproduction of pro-fibrotic factors and ultimately fibrosis. When this immune response is properly balanced in healthy lungs, it serves to heal wounds and recreate normal alveolar architecture. Dr. Robert Streeter, Professor of Medicine, Pathology and Pediatrics, and Chief of the Division of Pulmonary Medicine at the University of California, Los Angeles, will now take a more detailed look into this theory, beginning at the alveolar capillary wall.
Damage to the alveolar capillary wall and its basement membrane leads to the release of profibrotic cytokines into the region of injury. These mediators initiate fibroblast migration and promote their proliferation and differentiation into myofibroblasts. In IPF, these cells lay down an overabundance of extracellular matrix proteins, such as collagens and proteoglycans. Due to the suppression of specific degradative enzymes, these structural components do not undergo normal resorption and remodeling, thus resulting in further damage to existing basement membrane, inhibited re-epithelialization, and loss of alveolar function. Fibroblasts and myofibroblasts fail to undergo apoptosis and begin to occupy the alveolar airspace with enhanced deposition of extracellular matrix. They secrete factors that promote development of granulation-like tissue with processes such as fibrogenesis and angiogenesis, making further resolution impossible. As a final insult, hyperplastic type 2 epithelial cells attempt to re-epithelialize the modified or damaged basement membrane, but fail to reestablish a normal functional alveolus. This abnormal healing progresses insidiously to a temporally heterogeneous pattern, interspersing healthy lung tissue with a gradually increasing collection of fibroblastic foci, honeycomb cysts, and interstitial inflammation, which we characterize as idiopathic pulmonary fibrosis. In the end, these new discoveries, implicating persistent or recurrent antigen exposure, which leads to aberrant innate and adaptive immune polarization, resulting in abnormal wound repair as the primary pathogenic events in IPF, have opened many new avenues of potential research into novel therapies, and these prospective interventions will be investigated with the goal of providing an improved quality of life for patients with IPF.